Here is the scapula. This is the spine, the acromion process, supraspinous fossa, and that muscle is the supraspinatus, infraspinous fossa, and the muscle is the infraspinatus. There is a lateral border, and this muscle, the teres minor, this the teres major, and this region below the glenoid cavity, this region has a tubercle named as the infraglenoid tubercle, which gives origin to the long head of the triceps. This is the lateral head of the triceps. This is the deltoid, and this is the lateral head of the triceps. The lateral head has been cut, and this small section has been removed to see the radial groove. Now you can see three intermuscular spaces. This is the quadrangular space, this is upper triangular space, and this the lower triangular space. The boundaries of the upper triangular space, this orientation is helpful for identifying the boundaries. This is the posterior view of the right intermuscular spaces. So that is lateral, this is medial, superior, inferior. Now here laterally is the surgical neck of the humerus. The medial boundary is the long head of the triceps brachii. Superior boundary is the teres minor. Inferior boundary is the upper border of the teres major. There are two contents for this quadrangular space. These are the axillary nerve supplying the deltoid muscle, passes through this space from the posterior quarter of the brachial plexus. It winds round the posterior aspect of the surgical neck of the humerus. So here the axillary nerve has a very intimate relation with the surgical neck of the humerus. And this axillary nerve gives a branch to teres minor. The nerve to teres minor is characterized by a pseudoganglia, which is not a real ganglia, but it is just a condensation of connective tissue. And this axillary nerve is accompanied by the posterior circumflex humeral artery. This axillary nerve also has a cutaneous branch which supplies the skin overlying the deltoid, named as the upper lateral cutaneous nerve of arm. So this supplies the skin. If there is any fracture to the surgical neck, it can injure the intimately related axillary nerve that result in the paralysis of the deltoid, which affects the abduction of the shoulder joint, because the lateral fibers are the chief abductors of the shoulder joint, and also it affects the sensation of the skin overlying the deltoid. That condition is named as Regiment badge anesthesia. Now the boundaries of upper triangular space. This is the upper triangular space bounded by teres minor, teres major, and the long head of triceps brachii. The only content of this is the circumflex scapular vessels. The lower triangular space is bounded medially by the long head of the triceps, laterally by the shaft of the humerus, superiorly by the inferior border of the teres major. The contents of this lower triangular space is mainly the radial nerve and accompanying profunda brachii artery. The radial nerve also gives some branches in the radial groove. Actually, this part is the radial groove. crossing behind the humerus through the radial groove from the medial to the lateral aspect. In this region, the radial nerve is intimately related to the shaft of the humerus. If fracture happens to the shaft of the humerus, it could injure this nerve. The radial nerve is a very important nerve supplying the extensor compartment of the arm and the forearm. Now to sum up, infraspinatus, teres minor, teres major, long head of triceps, lateral head of triceps, and deltoid. Here is a supraspinatus muscle. Quadrangular space, bounded laterally by the surgical neck of the humerus, medially by the long head of the triceps, superiorly by the inferior border of the teres minor, superiorly by the inferior border of the teres minor, inferiorly by the superior border of the teres major. The contents of this quadrangular space is axillary nerve and accompanying posterior circumflex humeral artery. The posterior circumflex humeral artery is a branch of the third part of the axillary artery, and the axillary nerve is a branch arising from the posterior cord of the brachial plexus. This axillary nerve supplies the deltoid muscle, as well as it gives a cutaneous branch which supplies a skin overlying the deltoid, named as the upper lateral cutaneous nerve of the arm. This axillary nerve also gives a small branch to the teres minor muscle, which is characterized by a pseudoganglia, which is a condensation of connective tissue. The axillary nerve is related to the surgical neck, so if there is any fracture to the surgical neck, it could easily damage the axillary nerve, which result in paralysis of the deltoid as well as loss of sensation of skin overlying the deltoid muscle. This condition is named as Regiment badge anesthesia. Here is the upper triangular space, superiorly bounded by the lower border of teres minor, inferiorly by the superior border of the teres major, and medially by the medial border of the triceps brachii. The contents of the space is circumflex scapular artery, which is a branch of the subscapular artery, and the accompanying circumflex scapular vein. The lower triangular space is bounded laterally by the shaft of the humerus, medially by the long head of the triceps, superiorly by the inferior border of the teres major. The contents are the radial nerve and the accompanying profunda brachii artery, and the nerve is related behind the shaft of the humerus in the spiral groove or radial groove. If there is a fracture occurring at the shaft of the humerus, it could easily injure the closely related radial nerve, which result in the paralysis of the extensor muscles of the forearm, and it may result in partial paralysis or complete paralysis depending on the level of the injury in the arm. Thank you.